So thank you for the kind introduction, and thank you for inviting me here. Thank you to you guys actually. The reason we are here is because of you guys. So I will just quickly go over this presentation, which is actually Vicky asked me to go over hemorrhagic stroke, and at the end or even during the slides, if you have any questions at all, please stop me and ask. Feel free to ask any questions you guys have, okay? So we are going to talk about like what are the different kinds of stroke, what are the signs and symptoms. Also we'll talk about what are the things to do when somebody is having a stroke. We are going to talk about what time is brain means, and what are the different therapies which are available currently for hemorrhagic stroke, also about the prognosis, and then also we'll talk about how to prevent somebody from having a stroke. So this picture shows you basically that there are two major kinds of stroke. One is ischemic stroke, which is this one, and that's actually the most common kind of stroke. About 80 to 85% of the time when we talk about stroke, this is ischemic stroke, which is because of a blockage in the blood vessel. Are you guys able to see it, or do we need to dim the lights, or I think we're...
Can you guys see it well?
I can
Dimming the lights. Yes.
No, even better.
I mean,
Better?
so much better.
All right. So you can see clearly like there is a blood clot here inside the blood vessel, which is causing this area of the brain not to get oxygen and nutrients. So this is the main kind of stroke, which is similar to a heart attack or MI, when somebody is having a chest pain and they have a blockage into their blood vessel. So this is the common kind of stroke, which is about 80-85% of the cases. And the other type, which is actually worse than the ischemic type, is because of a leakage in the blood vessel. And when it happens, there is actually blood spillover into the brain. We're not going to talk about the ischemic stroke, which actually, luckily, we have a lot of treatment options now available. And in the last few years, we have a lot of clinical studies actually showing that if we help these people on time, then we are able to help those patients and reverse the disability which they have. You have a question, sir? Or?
No, I was saying is
He burped. He was just.
Okay. No problem. So, again, another picture or a cartoon showing you basically two types of stroke: ischemic stroke on the left side and hemorrhagic stroke on the right side.
I have a question.
Yes.
You said the ischemic stroke, well, actually the hemorrhagic is worse because there's a leakage with the ischemic stroke.
So I'm
The
going
leakage
to.
is going on for quite a while before the stroke actually happens.
So very good question. It basically, once we go over my rest of the slides, hopefully it will have answer to your question.
Okay.
But if at the end still that answer is not cleared, I'm going to explain it to you.
Oh,
Okay.
Right, fine.
So we're going to talk about different stroke facts. So what do we know about stroke? So unfortunately, it's the 5th leading cause of death in the United States, killing almost 140,000 Americans, and 1 of every 20 deaths actually is related to stroke. Some people call it a brain attack, and that's the first type of stroke, which is the ischemic stroke, when we talk about a blood clot blocking the blood vessel and causing that area of the brain to die. In the United States, every 40 seconds, someone is having a stroke. And unfortunately, every 4 minutes, somebody dies of stroke. So it's a big problem which if proper attention is given, the prevention is key again. And once it happens, then fortunately we do have treatments available at this point. Every year about 795,000 people in the United States have a stroke, and there are a lot of people who actually have recurrent strokes. So once you have a stroke, unfortunately people keep on having strokes again.
No pain,
Exactly.
no pain.
So our main goal is, first of all, to prevent the first stroke, but unfortunately, if somebody has a stroke, there's a very high proportion of patients who actually have a second stroke, so we need to prevent that from happening. It's an important cause of disability, and it reduces mobility in more than half of the stroke survivors if you are 65 and older. All right, so we're going to talk about hemorrhagic stroke. So what hemorrhagic stroke means is, as the name suggests, hemorrhage means bleeding, and stroke means brain, part of the brain not getting blood flow or gets damaged. It's a kind of disease which is similar to other neurological diseases, but it's a medical emergency, meaning that when the stroke happens, it happens really quickly. It's different from conditions like nerve problem, like neuropathy, or when somebody has myasthenia gravis, or other diseases which comes slowly. So this happens right there. As a matter of fact, anybody can have a stroke at any point. So it's very important to know about what are the things which we can do to prevent it from happening. So when there is leaking of the blood, what happens is, as you can see, this blood in the brain is going to cause the damage. So it depends. When you ask, like when I said that hemorrhage stroke is worse than ischemic stroke, it depends on the amount of bleeding or amount of the damage. How much blood is there, which area of the brain it involved. So there are a lot of things. So there
I'm so
are,
sorry, I just kind
No,
of
no, no,
turned it
it's
all the
okay.
way off. I turned the volume down. That didn't do it, I'm sorry.
so when you talk about hemorrhagic stroke, there are two main kinds. One is intracerebral hemorrhage, and the second is subarachnoid hemorrhage. Although there are many other types of bleeding in the brain, but when we talk about spontaneous bleeding, meaning that somebody can have bleeding inside their brain because of injury also, like car accident, or if somebody decides to be in a good mood and start fighting with their wife or something, hitting the head, it can cause bleeding in the brain, right? So we're not talking about those, because those are different diseases. We're talking about when somebody all of a sudden started having weakness on one side. Again, there are two main categories, ischemic stroke and hemorrhagic stroke. And when somebody has a hemorrhagic stroke, there are two main kinds of hemorrhagic stroke. One is, which we call intracerebral hemorrhage, and the other one is subarachnoid hemorrhage. So this picture will help you understand. As I said, 85% of all the strokes are ischemic in nature because of the blood clot. Then this is the intracerebral hemorrhage, which is actually out of those two types of intracerebral or hemorrhagic stroke. This is the more common type than the subarachnoid hemorrhage. And what it is it's the bleeding inside the brain tissue, like here, or any other place. So this kind of bleeding, which is intracerebral hemorrhage, is actually in the brain tissue itself. Versus subarachnoid hemorrhage is the bleeding on the surface of the brain. As you can see, the blood is actually seeping into these places, the spaces between the brain tissue. So it's not bleeding inside the brain tissue, but it's bleeding around it. And in the next few slides, you guys will understand that why it's important to know that where is the blood, because this changes our management.
Okay, hang on a second, let me get that for you.
Putting out a fire quickly can stop it from spreading. Treating a stroke quickly can reduce damage to the brain. If you learn how to recognize the telltale signs of a stroke, you can act quickly and save a life, maybe even your own. For both men and women, look for these 5 signs of a stroke, all of which come on suddenly. 1. Numbness or weakness in the face, arm, or leg, especially when felt on just one side of the body. 2. Confusion, including trouble speaking or understanding speech. 3. Trouble seeing, from one or both eyes. 4. Trouble walking, or problems with balance or dizziness. 5. Headache, especially a severe one that comes on suddenly. The clock begins ticking as soon as you spot the signs of a stroke, because some treatments can only be used if the patient reaches the hospital in the first 3 hours after symptoms appear. So don't wait. Call 911 right away and get the person to a hospital immediately, even if the symptoms go away. If you think someone is having a stroke, remember the word FAST. F is for face. Ask the person to smile and check whether one side of their face is drooping. A is for arms. Have the person raise both arms and see if one arm drifts downwards. S is for speech. Ask the person to repeat a short phrase and notice if their words sound slurred. And finally, T is for time. If you spot any of these signs, call 911 right away to get the person to a hospital fast.
Quick video.
Strokes are medical emergencies. The sooner a patient gets treatment, the better their chance of a good recovery.
Sorry, guys.
No, it's okay. So this is a good website which has a lot of resources, and at the end I'm going to tell you different websites where you can get a lot of good information about the stroke. So you guys learned from this slide about FAST. So what it is basically, let's say if all of a sudden somebody start having symptoms of drooping of the face, or A is for arm, weakness in the arm, or it can be in the leg. Speech, when somebody is having trouble talking. What is T? T is for 911. So call 911 as soon as possible, because a lot of our treatments, are time sensitive. Okay? All right. So again, the same thing, fast, face droop, arm weakness, speech, and to call 911. And as you saw in the video, there can be other symptoms of stroke also. All of a sudden, somebody start having bad headache, or some people call it worst headache of their life. That can be a symptom of a bleeding kind of stroke. So very important that you don't dismiss. And I'm talking about not somebody who's having a daily migraine headache and start having headache. That headache characteristic is totally different. It's like a worst headache you can ever have. That's a very common symptoms of a bleeding kind of stroke, which is because of bleeding of an aneurysm or rupture of an aneurysm. Yes. No, go ahead.
I need to ask, I guess, because with all the symptoms, and they said the face drooping, and so, I mean, I didn't have a drooping, but I had a sensitivity on this side of my face, which when I touched it, it was like I was burned or something, that it was really, really tender. What, I mean, have you ever heard of that as being a symptom?
Yes.
Oh.
So the stroke symptoms, the FAST acronym is actually just to simplify for anybody, layman people, that these are the things to look at.
Yes.
But the common symptoms which can happen is, we'll start from top to bottom, so that everybody understands what can be the symptoms of stroke. Headache, so bad headache is a symptom of stroke. Going to the eyes, if you start having loss of vision or blurring of vision in one eye or both the eyes, that could be the symptom of stroke. Then numbness on the face, on one side usually,
Yes.
drooping of the face, which can cause you to have slurring of the speech, confusion. A lot of the time stroke gets missed because people think that they are confused, or maybe they had a little bit of more beer or something else and they look drunk, but those could be a symptom of stroke. Inability to get your words out. So you want to say something, but it's not coming to your mouth. Or even when you're talking, the spiel is jumble, mumble. We use the term known as word salad. So those could all be the signs of stroke. Numbness on one side of the body. Weakness. And it's usually on one side affecting, although in rare cases it can affect both sides. So I always tell the patients and their families it's always good to overcall than to undercall. Meaning that if you are worried that it might be a symptom of stroke, it's better to call earlier rather than being sorry the next day. Because if that was a stroke and you missed calling on time, then we could have provided a lot of treatment options, which is actually time sensitive, and even more time sensitive than any other condition, any other disease, even the heart disease, because brain is very sensitive, and every single second when it's not getting enough oxygen or there's leaking of blood, the damage is multiplying, not like just adding, and multiplying exponentially. So very important. So yes, numbness can be a sign of stroke. Walking difficulty or having imbalance could also be a sign of stroke. So those are the main things which can represent, and usually it's all of a sudden. A lot of people will have a stroke when they wake up, or sometimes stroke wake them up from sleep. Nausea and vomiting. So especially in the bleeding kind of stroke, when you have bleeding in the brain, it can cause you to have bad headache, and it can also make you throw up. So if you're having headache along with nausea and vomiting, although it's different because migraine headaches can also have headaches. If somebody has migraine, they will know like they can be nauseated. But migraine people can have stroke. So anybody can have stroke. So it's very important to actually identify. And I'm not saying like if you have migraine and you get 3 migraines a day, every headache you get, you call 911. I'm saying if the headache is different in characteristic, or it's not like your typical tension headache, then it means it could be a sign of stroke. Yes.
Yeah, doctor, I don't want to, my wife was 44 and she had 2 strokes and then died of the 3rd. I don't want to, I mean, it's a personal thing, so I'm not going to tell, I'll tell you personally, me and you, but I won't tell in front of everybody what was in the police report, but I know what was in the police report because I read it, okay? If a person was having a stroke, could they become very, very hot? And there's a reason why I'm asking you that question, because I read something in the police report. You see what I'm saying? But could a person become extremely hot? I know about the other things, that they could get dizzy, they could vomit. I was hearing what you're saying. But could she have became very, very hot?
So it's not a common symptom if somebody just feel hot, but if it's in addition to other symptoms, meaning that, and I'm sorry to hear about your wife, but
She did something. There was something that she did. That's why I asked you if she could get very, very hot.
So what can happen is, let's say if you take an example of somebody driving a car and all of a sudden it gets involved in an accident. There is a possibility that they might be having a stroke before the accident happened. So
I see.
it's a stressful response to your body. Like if somebody is having, let's say, a heart attack.
If we have some time, I'll tell you what she did. I'd rather not in front of all the people. But in the police report, she did something a little peculiar. You see what I'm saying? And I've always had problems with that. Because
It can cause confusion, Robert. It can cause confusion.
oh, okay. Because some people were suggesting that maybe she was murdered. And was it a stroke? The police ruled it a stroke.
Let's,
But there never was an autopsy now.
let's let Dr. Saeed go on, okay, because we've got a little short on time.
But I'll be happy to talk after the talk.
Okay.
Because I wasn't with your wife and.
Oh, I understand. I don't
Right.
even think you was working here when that happened. That happened several years ago.
Okay.
And even if you knew of the case, you couldn't discuss it because it's a medical case.
And a lot of the times, the heart attack and the stroke are very common things, and people get mislabeled with those also. Meaning that, let's say, if you fall from a building and hit your head, they might say that you had a stroke. But what we are talking in this is not about those things. We're talking about if somebody is at their work and all of a sudden develop symptoms, no trauma involved, no injuries. What could it be? Okay. So what are the things to do? So let's say if all of a sudden your family member or yourself start having those are features or symptoms of stroke, what would you do in that scenario? So there are the things not to do. Things not to do. So what you don't want to do is don't give anything by mouth, because stroke can affect your swallow and they might be confused. You don't want to give anything into your mouth because it can hurt. Of course, the first thing is to call 911 as soon as possible, but those are the things not to do unless they are advised to you by the 911 people or the paramedics. Do not give aspirin. So very commonly, and it's a common thinking that when somebody is having symptoms of stroke, you will open up aspirin and give them 4 aspirin or big aspirin. Why it's not a good thing? Because there is a possibility that they could be having a hemorrhagic stroke, meaning bleeding in their brain, and aspirin being a blood thinner can actually worsen the bleeding and may make the blood more thinner. So that's not a good time to give it. Even our ischemic stroke patient, the cutoff thing or the key thing to differentiate between an ischemic stroke and hemorrhagic stroke is a CAT scan, which will tell us if it's which kind of stroke it is. And of course, we can't get it at home or even reaching the hospital before reaching the hospital. So very importantly, the third thing is do not give any blood pressure medicine. Let's say if you check a blood pressure and even the blood pressure is high, let's say 180 or 160 or 170 or 200, that's not a good time to give them a medicine because of 2 reasons. One is, as we said in the first point, do not give anything by mouth. And the second thing is, one kind of stroke, which is the ischemic stroke, not the hemorrhagic one, those patients needs more blood pressure at that time. So if you're going to drop the blood pressure, you can cause more harm to them. And very important advice is do not drive to the hospital. The best thing is to call 911, and the reason behind is when you come by ambulance or when you call by paramedics, they identify the symptoms of stroke and they pre-notify the hospital before you guys are even here so that we are ready for you. Versus, the reason I'm saying is I had patients in the past who decided to drive, but then when you reach the hospital, you might not get that importance in the triage area because you might not be believed to be that sick compared to a patient coming by hospital. And as I said, the treatment of the strokes are very time sensitive. The second thing is if you're driving, you might cause another accident by driving it fast yourself or somebody helping you. So not all the stroke centers are, or not all the hospitals have the capability of providing stroke treatments. So you might drive to a hospital or go to a place where they might not have the facilities, and that will further delay the treatment. So very important that call 911 as soon as you identify or you are worried, or even there is a very low index of suspicion that somebody is having a stroke. Is, as I said, always good to call over call and call in time, call early as soon as possible. So this is a picture which is showing you a CAT scan of the brain, and this is a normal CAT scan. The white thing is the bone, which is the skull. This is the brain tissue. This is a normal CT scan or CAT scan. This is the front of the brain. This is the back of the brain. And you see that this is blood. So this is what we call bleeding kind of stroke, which is because of the blood in the brain. So everybody who's coming to the hospital with stroke symptoms gets a CT scan. And the reason is our treatment options are different. 80% or 85% of the time when we talked about ischemic stroke, which is because of a blood clot, the treatment options are to give them blood thinners. And now we have surgical options, meaning that we can pull out the clot from the brain. This kind of stroke is different because there is no blood clot in the blood vessel. This is because of rupture or opening of the vessel wall, one of the artery or the vein. It has a leak, and now the blood is leaking into the brain. So the treatment options are totally different, 180 degrees different from the ischemic stroke. When you're having those symptoms at your workplace, at your home, you don't know what kind of stroke you're having. So that's why the recommendations are not to do anything rather than coming to the hospital as soon as possible so that a CAT scan of the brain is done and can tell what's going on before we start treating that. Okay? This picture is actually a picture of subarachnoid hemorrhage, which is because of bleeding aneurysm. And the blood is not in the brain tissue, but outside the brain tissue in the places around the brain. So this is the less common kind of hemorrhagic stroke, but this is the kind of stroke which is more fixable, meaning that this kind of stroke happens because of bleeding aneurysm, which is abnormal blood vessel or ballooning of the blood vessel, which I will show you in my next slide. But this is a kind of stroke which is worse than the other two kinds of stroke. The reason behind is 50% of the patients who have this kind of bleeding are not even able to reach the hospital, meaning that they will drop dead.
What is that like section on the left?
This is just this one. This is just the air, air in your ear canal. So this is like a known thing. So this is not the abnormality. The abnormality is this blood.
Right.
What is that stroke type called?
What's that?
What's that stroke type called?
This is known as subarachnoid hemorrhage.
Stroke, what is it?
Subarachnoid. I think I had a slide before,
Yeah, sure.
but it will come again.
Okay.
I'll show you
Okay.
in my next slide. But in simple terms, it's because of a ruptured aneurysm, bleeding aneurysm in the brain. The fancy name is subarachnoid hemorrhage, meaning that it's hemorrhage, as you know, but it's between the layers of the brain and the covering around it. So the brain tissue itself and the layers around it. That's where the blood is.
Well, there seemed to be more blood when it was like just a regular hemorrhagic. So what's so deadly about it being between and not as much blood as the other blood?
Very, very good question and
Yeah.
very important thing, because
Yeah.
in this one, the blood is not in the brain tissue. It's outside the brain tissue. So you'll assume, or you will say that why this shouldn't be that much worse than the other kind of stroke. But the reason why this is bad is when this happens, it affects your whole body. And one of the common presentation of this kind of bleeding stroke is a cardiac arrest.
Okay,
So because it's a so much stressful response on your body.
okay.
So when you ask like, can you have like a stroke when somebody's feeling hot? To answer, this could be the time because you're having bleeding in your brain, an aneurysm is ruptured, and you can have a lot of different symptoms, meaning headache, usually a worst headache of your life. You can be nauseated, you can be confused, you can feel hot. So when there's a combination of all those symptoms, this could represent that somebody's having bleeding in the brain. and it has direct effect because it's a stress response. As I said, 50% of the people will drop dead on the scene, not even able to reach the hospital.
Is fear one of the components of that? If a person realizes something's happening to them, they're so frightened until they help the situation?